Fantastic. Thank you, Elizabeth, for doing all the organizing on the site. We just have a few reminders and some highlights from Urban to share. Thank you to everybody who did their data inventory. We really appreciate it and understand the extra work, especially with our clunky website system, but it means a lot to us to have this information. We refer to it often internally, and it helps us to speak externally to other folks about what data people have. So if you haven't done it, please submit it. We had skipped a year or two with just one with the pandemic. So so even having current information is really helpful. And the thanks to Leah, who matched everybody on the buddy copy. She was the mastermind of the Excel sheet. I just was the deliverer because I have the Word add-on that worked for the mail merge. But the pairings went out on Monday for those of you participating. I appreciate all I've been getting like lots of friendly messages about people setting up meetings, which is cheerful. I usually don't like extra email my box, but these emails make me happy spontaneously during the day. So if you haven't reached out to your buddy, go ahead and do so. We knew it was vacation time for a lot of people, so just anytime in the next month. This is it's both a warm up for the NNIP for the in-person meeting, but also to try to loop in and connect with people who may not be going to the meeting in December.
Yeah, so you definitely don't have to be going to the meeting in order to participate. There's been a little bit of confusion on that.
And I just sent the note about office hours out to the Google group this morning. So please sign up to talk to us. Another day that we really enjoy in the month. And the partners meeting is in DC. I don't know how many people we have registered, or if we want to tell people that number, but
we've got about like 45.
Oh, that's good.
Yeah.
I mean, for where we are 2 months out. So if you would like to come, we would love to host you and show you our beautiful building and city and highlight Leah's and Elizabeth's and others' great work in DC as a local partner. Thanks, Jake.
You should get people should get another reminder, I think today or tomorrow. I realized the automatic reminder was only reminding people who hadn't opened their first invitation. So we will do a full reminder, including those who looked at it a month ago, but cannot find it now.
I don't think that's true because I got a reminder.
Well, it noted only sending like half of the reminders, half the recipients.
Well,
but you're registered, Kathy, so you
yes, that's why I was confused.
Yeah.
But we will continue. At some point we stop sending reminders. So at some point we assume we will do a couple more calls, but then assume anybody who wants to come have registered so far. We just got Denise Ross confirmed, the chief data scientist for the US and New Orleans NNIP alumni partner. So we're excited about that. And then, yeah, just leading up, we're launching the virtual wall for the camp sessions, the breakout sessions for NNIP week after Labor Day, when everybody settles in for the fall, which came very quickly. Next slide. I wanted to, well, partially because this has just taken up all of my life, the Microsoft Catalyst program grants were released I don't know, 10 days ago or a week and a half ago or something like that. We're very excited. There's 30 amazing local work, local projects. One, I sent out a note of them just to make you aware. There's many projects in NNIP cities that may not be directly connected to NNIP, but the one that I wanted to congratulate in particular is the Polis Center, that this is their second time winning the grant with a really strong local partner and the their description. But nobody's from here. I do not know how to pronounce this name yet. I meant to. We need Capru. So I apologize for mastering the name, but encourage people to take a look at those great projects around. The Indianapolis one is around analyzing sort of the results of prosecution by age, race, and gender. That's there. We wanted to, if you have questions about it, congratulate Sonia, who is one of the authors on a really popular report on sort of the intersection between civic engagement and equity. So congrats to her for how successful that's been so far. And if you want to share it with your local government folks, Sonia can put a link in the chat. And also congratulations to our DC partner for, if you saw this, a really good, really in-depth New York Times article on the 11th Street Bridge project, which will also be featured at the NNIP meeting, which quotes our colleague Mary Bogle. We've been a evaluation monitoring partner with them from the very early days. So it was great to see that recognized nationally. And then just we didn't quite get them out for this meeting, but news stories will be coming out any day now for Atlanta around economic development. Oops, Milwaukee misspelled, that was me. Around criminal justice. The San Antonio has one about corporate philanthropy and equity, and Seattle has one about their COVID dashboard. So these are from folks that applied for the NNIP Impact Awards. And we are excited to share their stories out of their local wins. Is there anything else, Leah or team, that you wanted to add before we jump in?
Nope, good from my end. Thank you. We'll get going on our presentations today. We first have Annie Kaller from the Boston Indicators presenting on the care work in Massachusetts, call for racial and economic justice for a neglected sector. And then Liz and Aaron from Pittsburgh will be presenting on their guide to libraries and the civic data ecosystem. And then Leah and myself will end today talking through our DC eviction prevention work that we've been doing the past year now. So Annie, I'll stop sharing and pass it to you.
Awesome, thank you. Sorry, I realized I was very close to the screen. Thank you for letting me present today. This is the first time that I've shared this work outside of our close-knit circle of, internal colleagues and like external partners in Massachusetts. So please bear with me. And I'm looking forward to your comments. I'm a bit afraid that it might be longer than needed. So I don't know if there's a way to flag me if I'm speaking too much and need to cut it. Thank you. That'd be great. All right, so let me go ahead and share my screen. Awesome. So Boston Indicators is the research center within the Boston Foundation, which is Greater Boston's largest community foundation. Because of that, we're pretty plugged into a civic ecosystem within the city, which is fantastic. And so we worked on this report largely on our own. We wrote it independently with the help from many partners, but we're partnering with SkillWorks, which is a workforce development funder collaborative in Massachusetts to release the report and produce an event that on September 7th. I would flag that we did work closely with the professor at UMass Lowell, Minion Duffy, who's worked in this field, and thank you, NNIP, also Kathy, for providing thoughts very early on in this project. So with this project, we wanted to provide a deeper look into who our care workers are in Massachusetts, specifically looking at the lower wage care workers, including home care workers, long-term care facility workers, and childcare workers. We chose these three occupations, knowing that care work can be defined, as expansively as including teachers and doctors, or as narrowly as just folks, who care for folks who can't care for themselves. We chose these three areas because we found that these are where low wage workers are typically concentrated, and also where workers tend to be are disproportionately women, and particularly women of color. For our paper, we did 6 things. We provided a brief history of care work in Massachusetts, looked at the demand for care work, a profile of these care workers, and a job quality analysis. We also did a brief foray into unpaid care work, and then finally offer concluding policy thoughts. Our ultimate goal is to kind of make the case that care workers, in particular the 3 occupations that we flagged, should be included as a critical component of any racial and economic justice agenda. So I'm going to attempt to present our brief history of care work in a brief fashion. We'll see how well this goes. We wanted to include this in our report because we think it's important context setting for understanding why it is that we do not pay care workers well. And so in our report, we begin briefly looking at the connection between care work and slavery. So before the Industrial Revolution, care work was almost entirely performed at home by women who were obligated into these roles by, often familial relationships. The context depended greatly on how care work was performed. And so many enslaved Black women were forced into domestic labor that was physically taxing, placed them at high risk of abuse in all forms, and denied them the ability to care for their own family, their own children and kin. In contrast, around this time, white women's care work became elevated and became idealized, and it stood in contrast to the public sphere that was reserved for men and viewed as not as morally superior, if you will. I flag this early distinction because we kind of see that distinction between basically how care work has been racialized throughout the history of care work and into the way that care work occupations are divided now, or rather who performs what within care work. As you know, this is my first time saying this out loud, so deep apologies, but the hard reality of caring for children, sick, and the elderly stood in contrast often to this idealized notion of white femininity that emerged in the 19th century. And it was ultimately the labor of Black, poor, and immigrant women that really solved or resolved this contradiction. So Black women and domestic servants were responsible often for the harder tasks associated with domestic labor, such as cleaning floors, nursing tasks, laundry, for example, while in many ways, white women, particularly white wealthy women, became the public face of care work, doing jobs like acting as a hostess or a supervisor. This continued throughout the early 20th century. Even after emancipation, many Black women were forced back into care roles, through exploitative labor agreements and whatnot. In the North and the Midwest, Black and Indigenous women found their labor market opportunities really fairly constrained, as they were excluded from better paying and less physically demanding labor like clerical work or retail. And in the West and Southwest, Asian, Mexican, and Indigenous women were often channeled into domestic labor like commercial laundries or as maids. The rise of modern medicine in the early 20th century led many care work activities to transition to both hospital settings and nursing care facilities. The number of hospitals proliferated in the early 20th century. Medicine became increasingly professionalized. And as technology evolved, we started to see more support work positions develop within care facilities and hospitals. So like certified nursing assistants, for example. And there we continue to see this racialized division of labor, where a lot of the harder tasks were disproportionately occupied by women of color compared to registered nurses, for example. Which is not to say that it's not hard labor, but the labor is, yes. And then moving on to the early 20th century, many care workers were excluded from these early labor reforms. So for example, the National Labor Relations Act asserted the right to unionize, but left out domestic workers. Domestic workers, really all service occupations, were excluded from the Fair Labor Standards Act that created a federal minimum wage. And while 1973 amendments extended protections to many service workers, those that were labeled companions were exempted from this, and that ended up encapsulating most care workers in home and assisted living facilities. It wasn't until 2015 that federal protections really extended to most care workers. So finally, just flagging again that we talk about the growth of many the need for home care workers, for workers caring for our elderly and sick. And a lot of this is because our life expectancy has just risen. And as our technology grows, we have increasing demand for folks to care for our most vulnerable. And with that, I'm going to try and jump into a bit of where we're going from here. We know that there's been a shortage of care workers, both child care workers and increasingly with after the pandemic of folks working in nursing facilities and as home care workers. On top of that, we expect in Greater Boston the number of retirees to grow significantly in the next 20 years, as well as those that are 85 years or older. And this number in particular is important because those are the folks that are more likely to need daily assistance. We used state long-term occupation projection data to look at different, the expected growth for different occupations. And as you can see, they project pretty significant increased demand for personal care aides, home health aides, and psychiatric aides and nursing assistants. There is a small projected decrease in childcare workers. One thing we flag in our report is that there is generally just a shortage of childcare workers already. And so when we project the number to decline slightly because of demographic reasons, it doesn't fully capture the need that we would expect moving forward. Looking at a demographic profile of our care workers, who are they? In Massachusetts, they are overwhelmingly women. And this is true for all three of the occupations or areas that we looked in. Care workers are disproportionately women of color, and particularly Black and Latinx. So while overall in Massachusetts, Black workers make up only 7% of the workforce, they make up 24% of the home health care workers, and they make up 43%, of long-term care facility workers. So that's about 6 times higher than their share in the overall labor market. With Latinx workers, we see that they make up roughly a quarter of home healthcare workers, despite only accounting for 11% of the overall labor force. Childcare workers match more closely the demographic, the racial demographics of the state labor force, but again, are 92% women compared, which is not the case for the overall labor force. Care workers in Massachusetts are more likely to be foreign born, and this is true nationally as well. And looking to job quality, this is, I don't think, a surprise to anyone, but in Massachusetts, care work wages are significantly lower than that of all workers, or the overall average for workers in Massachusetts. Massachusetts does have a fairly high state minimum wage, and we're by 2023 we should hit $15. So these numbers to internal audiences will appear pretty low because they cover the 2016 to 2025 year band because of the ACS data that we used. Care workers are also less likely to receive employer benefits. They're less likely to have access to employer provided health insurance, pension plans, for example, as well, which we don't have included here. Care workers in Massachusetts are more likely to receive Medicaid. So I found this startling, roughly 1/2 of home care workers rely on Medicaid for their health insurance. In Massachusetts, it's called Mass Health. We wanted to briefly discuss unpaid care work as well, just because when we think about the broad ecosystem of care, this is a pretty significant part of it still. We used American Time Use Survey data to look at who's performing care work and how much time they're spending on it. And we found that women were more likely to perform care work. And within that, women typically spent more time performing care work, both for children and for adults. And this, of course, has ramifications for their own ability to participate in the labor market, especially if you don't have access to, sufficient employer-provided benefits. Another interesting fact pulling from a national report, I believe by AARP, is that the number of family caregivers has increased significantly in the past between 2015 and 2020. And often this is not something that folks do out of their own volition. They feel like they don't have a choice necessarily in providing care or taking on a caregiver role. Our goal was less to present a policy paper and more to kind of begin a conversation about who's performing these jobs and what challenges exist for those workers, but we did include a short concluding policy section that grew as we involved more external partners. Things that we could do to improve job quality for care workers in Massachusetts include continuing to strengthen the state minimum wage. So it's going to be 15 in 2023, but that's still significantly below a living wage for workers in Massachusetts. Sorry, I just saw the message about 4 minutes left. I'll go very quickly. Increasing reimbursement rates through Mass Health, which is our Medicaid. We don't have a licensing process for home care agencies in Massachusetts, which leaves the state with very few options to actually regulate home care agencies. Improving access to training and career ladder programs. We have an earned income tax credit. It doesn't currently include unpaid caregivers, but there's somewhat movement to try and do that. We have existing legislation that would really increase access to education and early childcare. Early education and childcare. It didn't pass this session, but we hope that it will happen soon. More broadly, we can make it easier to collectively bargain. And finally, many care workers are relying on our public transit system that is pretty inadequate these days. And the cost of living in Massachusetts is so high that expanding affordable housing opportunities is something that we have to include in basically every report. So thank you for bearing with me. I'm happy to answer any questions.
Thank you, Annie. I appreciate your historical context and the intersection of women and people of color, which has led to all of this that you presented. Does anyone have any questions?
Annie, just tell us a little bit of, well, if does somebody have a question first? If not, tell us a little bit about your rollout, who you want to listen to this report.
That's a great question. As I was presenting it right now, I realized that I spent a lot of time on the history, and really I think what we want people to spend the most time on is the demographic profile and the job quality analysis. So we're hoping to get some media coverage, partner with some local reporters to release an article around Labor Day that kind of does a profile of care workers in Massachusetts. We have an event scheduled for September 7th, and we're hoping to do a panel with both national and local and state leaders speaking about particularly the job quality for care workers. And SkillWorks, our workforce development partner, is kind of handling more of the long-term outreach, if you will. So
will it have a virtual, will you be streaming it too?
We will, yeah.
Oh, so you send it out on the, yeah.
I would just encourage you to include, at least a small bit of the history in those profiles, because I think that's a really important context for people to understand why the demographic profiles are the way they are.
Thank you. That's helpful. Yeah, that's a good point.
That's information people may not expect.
Yeah, absolutely. We're also partnering with some local unions. And so that's been a good, they've really helped us with that as well. And then connecting with local elder advocacy organizations, as well as a lot of early education and childcare advocates, policy advocates. But even them, they were surprised by the history piece as well. So I'm glad that we were able to kind of, connect with academics and bring it to a broader audience.
Yeah, I was going to share it with our teams working on a new childcare program, or working with them. Trinity University, and coming up with how to advance careers in early childhood education in DC. So I thought that history would be super helpful for them to have.
Yeah. We have a near final PDF from which I pulled most of the graphics, but it should be finalized by next Thursday. So I can send it out then.
Great.
Yeah.
Does anyone else have any questions or things to add before moving on? Great.
Yeah, it seems great to just keep focus on this post, while we're just sort of shifting into COVID as normal. I know the essential workers got a lot of press during COVID, and as we sort of transition to a different, phase of it, then to keep this in the forefront feels like really good timing.
Thank you. We certainly hope so.
Thank you. Okay, Erin and Liz, passed off to you.
I can share.
Okay, I was just going to ask you. Great. Okay, thanks, Liz. I'll get us started. So hi, everyone. Glad to join you all today. I'm Aaron Brenner. I'm at the University of Pittsburgh along with Liz Monk. So I'm coming from the libraries. I work in the university library system, so academic library. Liz, who you all may know already, works at University Center for Social and Urban Research at Pitt and does a lot of work with the Western Pennsylvania Regional Data Center as well. So we're going to talk to you. We're at the end of a 5-year project that we've been working on with a team mostly based in Pittsburgh, but involving some others. And Kathy is a member of the team, and Jake, as we'll mention, helped out in an evaluation role, but mostly based in Pittsburgh. And this is work that focuses on libraries and library workers, but specifically working in partnership with other data intermediaries, data users, data producers in their regions to advance the roles that libraries can play. So this is work that was funded from the Institute for Museum and Library Services, IMLS, back in 2017. They then gave us a supplemental award after 2 years, and then of course a pandemic delay. So here we are 5 years later. We won't go through all of the work of the project. We're going to focus here because we have just a little bit of time on some of the final outputs, because we're excited to share them and they may be of interest to you or the communities that you work with. But just the briefest introduction to the principles of our work. As you see, one of our real founding principle here was this statement that libraries and library workers should be key actors in civic open data ecosystems and act as core data intermediaries. And it's not that libraries really weren't doing anything, but they certainly didn't have a clearly identified role. And back in 2017, it was really a moment when we were seeing a lot more regional or city-based open data portals coming into being, a lot of libraries making a turn explicitly to support data literacies or digital scholarship. So it was really, and also actually, I think taking another look, particularly from academic libraries at community engagement and like impact in the region. So it was really a time when a lot of different forces were coming together to make a project that tried to address this at a national level make sense. And then these two sort of principles in blue helped shape the form of the project. So first of all, libraries aren't at the center, as we know, but they should, we think, should be playing a role among a variety of other existing data intermediaries. And just speaking personally, coming from a library background myself, it was really kind of revelatory to learn about other data intermediaries and the NNIP network and see the similarities that many of you play to what libraries do, like very adjacent, but not quite the same. And I should also mention here that we were very interested in all kinds of libraries, so academic libraries, public libraries. We also ended up working with a couple of state libraries, so different library types. And then the second principle is that we recognize there's an awful lot of regional variation. So we weren't trying to come up with a recipe or a single model that would fit every city or region. There's quite a lot of variety. That's good, that's appropriate. So if we're trying to model at the national level, what we're really doing in practice is supporting a lot of local practice and then trying to capture the stories of things that work at local levels to share as examples for other folks who might be interested. Okay, so that's kind of the idea of our project. And I think is the next slide who we were. Yeah, and over to you, Liz.
Yeah, thank you for having us. We're excited to share the work we've done here. Erin touched on who made up our team, but just so you can see it, and another opportunity to share my paint graphic. So it was the Regional Data Center, the NNIP partner in Pittsburgh, the Academic Library, Public Library, and then Kathy from NNIP. She gave us lots of good insight as we went through our 5-year journey. So we'll just briefly share what our whole endeavor was. So part of this project was holding workshops for library and data partners. So we had people apply to come together. They didn't have to know each other or have an existing partnership, but we wanted them to come experience the workshop together. So we were able to hold 2 in-person workshops and then 1 virtual. And we found them to be very successful. Even just that people got to spend this dedicated time together felt really important. And these were held before, one was the NNIP meeting in Atlanta, and one was before Digital Library Federation, DLF, just outside of Vegas. And then we had cross-pollinators. So library partners went to the NNIP meeting, and then the civic data, non-library civic data intermediaries went to the DLF conference. Another piece of this project was funding work across the country. So we were able to fund 14 partnered field projects. And this was a range. Some were just like pretty small projects at $3,000. And then the other level was $9,000, which most of them were at. And these projects were also arranged. So some like mapping the civic data ecosystem in the state of Alaska, or just holding community conversations. So it was definitely a range. It was really fun for us to see all the work and meet people in the same sphere as us. And we were able to fund NNIP partner friends also. I don't think I missed anyone. And then this piece, which is leading into what we're really sharing today, is we had developed a guide. So this is online and it is in good book, and there's a lot of words. It is, gives a lot of background context, shares library roles, barriers. It includes case studies from all of the field projects that we shared, or funded, so in 2019 and in 2020. Okay, I'm going to send it back to Aaron.
Yeah, so we really wanted to have a version of the guide that we could either hand to people or they themselves could print out. And the website version of the guide that Liz just showed you, it's got all the words, it's very utilitarian, but it's not particularly designed or pleasing. So we were really fortunate to work with a graphic designer over the last year or so to make a printed/print ready version of the guide. Yeah, I see Kathy's holding one. I'm holding one too. My background blur is really messing it up. But it turned out to be about 96 pages. So it's still, it's substantial. But it covers the things that we mentioned. One of the other things I did want to mention is there's a section on library roles. You can kind of see it on the right-hand side of this clip. That might be of interest. Well, certainly we hope to libraries who might be wondering what are the different possibilities for us in this space, but also for you all who may partner with libraries from the other side of the relationship to just say, well, what could libraries do if we worked with them? Like how could library expertise around archiving or stewardship, just to give one example, be relevant to civic data? So I want to point that one out. So it's a little bit of like a very generic like principles how-to instead of a very specific how-to. And then those field projects that Liz mentioned, each one of them has a really nice write-up. This is mostly in the words of those project teams themselves, which was really important to us. So most of the text are the field awardees speaking. Just that little like orange box is our project team doing a kind of team take summary. But we were really happy with how this turned out, and you can see where each team is coming from on a map of the US, just to get a sense of the geographic breadth, but also, as we said, like the types of libraries. So this was a public library. We have profiles of work done by a couple of different types from all over the US. And then, because there are so many words and it's 96 pages, and that version of the guide we think is probably mostly of interest to people who are already already have some sense that they're interested in this thing, if you're going to be taking the time to read that much. So we wanted to have a different publication as well that would be much more lightweight, maybe aimed at, I love Kathy's question about audience from the last follow on from the last presentation, because we were thinking a lot about audience here. An audience of decision makers, so it could be library directors, for example, or folks in libraries who just, they aren't sure what this is about and want a, like I said, more lightweight introduction. So this guide is, what is it, like 18 pages, and it's many fewer words, and it really focuses just on a couple of highlights. So instead of all 14 or so case studies, we just picked 3, and then I clipped this last section. This little guide concludes with take action. So I think part of handing somebody something like this is hopefully that they end it by saying, aha, now what can we actually do? So that's our idea, but we've both of these are available for download, and we were able to, with our the remainder of our grant funds, print up quite a lot. So I see Bob saying that we'll bring copies to NNIP, but we're happy to share these with you. If someone can't get it at NNIP, yeah, we can get it to you some other way. And this is my last slide, right, Liz? Yeah. So one other outcome I want to highlight here. So I mentioned this was a 5-year project. Our initial funding did not include external evaluation. We got a supplemental award from IMLS at the midpoint, and they said, in order to get the supplement, we really want you to bring on an external evaluator. That turned out to be a really great requirement. And Jake, hello, Jake is here, and I think many or all of you know Jake, joined us as an evaluator. Did some really wonderful things, which are also public and maybe of interest. So Jake followed up with all of the folks that our project engaged with, interviewed the people who had done the field project awards and people who attended our workshops to kind of get a sense of the impact and follow up that made or did not make with them, and then worked with us to develop this logic model, which we hope could be useful for additional follow-on projects, just to make the case of what kinds of change we imagine this kind of work leads to. What are the outcomes? So that is also publicly available off of our website. And thank you, Jake. And then over to you, Liz.
Yeah, just speaking of follow-up projects, we did get funding for one of those. So we have a civic data education series. This is headed up by Nora Mattern, who is from the original project team. And it is building materials for people for the MLIS curriculum, but also for library workers in general, but also for anybody. So there are slides, scripts, and they're all recorded also with closed captions. So all of these things are linked as of yesterday on our project website, which we can put in the chat also. But we don't have a ending slide, but that concludes our time. So we will take any questions.
Yeah, thank you all for having us.
Thank you. Congrats on finishing up and having a project page now. A lot of work, can tell, went into that. Kathy, did you have?
No, do
something
other
you lighted
folks
up?
have questions or want to talk about how much they love their library?
I will just say on the how much you love your library. Having the chance to talk to all the libraries, I was so impressed by how much folks did with honestly what was a pretty limited seed grant. And a lot of that worked because a lot of the public libraries especially were able to do this work by incorporating this into sort of the core functions of their staff roles as a public entity. That's not always going to be the case, but and especially for academic libraries. But I think the broader point is it's really easy to get librarians to the table. It's not always going to take off. You might have to find a different department to dig into, but there's so much possibility here. And even reading through the case studies, there's so much variety of the types of projects that took place. And as Aaron mentioned, even at the state library level, there's just so much untapped opportunity to build relationships and to have these kinds of partnerships evolve.
Kathy, have we pushed the guide out to like
I think it was on the last newsletter.
Oh yeah.
I mean, we could still push it.
We've been talking about doing like a rollout, like just having a community of practice, introducing all the materials once the educational series is done. So I'll keep you guys in the loop on that.
I just thought we could flag for Casey too, to share with their networks.
Oh, the Kids Count folks.
Yeah.
They would be interested too.
I would also hypothesize that if even the brief guide feels intimidating to dig into, you could probably schedule a half hour with Kathy on her NNIP office hours, and she will tell you how to get started.
Yeah, I think there's a lot of ad hoc projects like John Clean did in Durham, but there's also sort of long-term teach them how to use the website and SEMA and in Baltimore, and the folks in Indianapolis that did data and drafts together. So there's a lot of different ways to plug in, but if you think about trying to reach regular people and like where regular people go for information, and they're all based in neighborhoods and communities. I mean, it's perfect for us. Cool.
I'd say like one other thing too is like it's an example of how we could all leverage NNIP and build opportunities to work with each other and projects. So I think that was like a neat thing from my perspective.
Great. Did anyone have anything else? Okay. Leah, you're welcome to start off, and do you want me to share for your
Yeah, sure. So Elizabeth, I stepped in here sort of last minute, so we do not have slides for you all, but wanted to talk a little bit about the work we've been doing along with our colleague Peter Tatian to support eviction prevention efforts in the District of Columbia. We have been since last July meeting weekly with a group of cross-sector group of local leaders from housing counselors to legal service providers, several DC agencies, including Department of Human Services and Department of Housing, along with a judge from DC Superior Court, to think about eviction prevention in DC, originally focused on spending the emergency rental assistance funds that came down from the federal government, but we funds really quickly. So our purpose has morphed a bit over time to thinking about eviction prevention more holistically, and really serving as a place where every week people can come together and troubleshoot problems. And Elizabeth's going to share a couple of examples of just the ability to convene people and have frank conversations about what's going on and what's working and what's not working has been really valuable. We don't have any products as of yet, but this was a 3-page document that took quite a bit of negotiation with the group to come to agreement on. If you've ever convened a cross-sector table of people, they are often in conflict, but on the same page at the same time. So we wanted to agree on our overall goal, which was to prevent eviction and displacement of low-income tenants in the district and stabilize their housing for the future. I think there was a tension I wanted to surface, just that eviction prevention isn't getting at the root cause of some of the issues of housing affordability and housing instability in the district. But we were trying to keep the group focused on eviction prevention and not globally things we need to be doing for affordable housing. We do also be needed to do those things, but trying to keep the group together and driving in the same direction was part of our challenge. So they have all agreed to this overall goal, and then we've outlined a couple of ways that we think collaboration has been particularly important in the district. I'm going to turn over to Elizabeth to talk through a couple of those examples.
Yeah, thank you. So as Leah mentioned, the different stakeholders part of it that are part of the group, especially our DC, DHS, and then our housing counseling, I forget what their housing counseling services, which is one of the ERAP providers in DC, which is now getting out the local dollars after the federal ones were spent. And then we also have a group of, I believe it's 6 nonprofit legal service providers, and they're part of a group called LT Land, which does receive not only local funding, but also funding from the DC Bar Foundation, and they have their own kind of group of collaboration and now have more funding for some of the more service provider additional housing supports rather than just looking at legal services, which is also supported by pretty strong tenant laws in DC, which makes a lot of this possible. But a few examples of some of this close collaboration, in addition to these weekly meetings, which the stakeholders highlight as the opportunity to talk through things and problem solve, which is one of the most important aspects, was that last fall started, and I think still continue with, last mile payments that ERAP providers work with DHS staff to get waivers out to people and who are facing eviction at the end of it. And this has prevented many people to not be physically evicted. And then there have also been instances of STADEC, the federal money, having tenants had eviction filed on them after they have actually received the funding. And so this has been a collaboration with ERAP providers and legal services, and then also DHS looking back at their instances of who has received payments and making sure that these buildings aren't filing on tenants who did actually receive the funding and that the landlords should have, and eviction without a cause for it. And then also there's been canvassing from both legal service providers who have received that additional funding, and also ERAP providers and different advocacy groups across the district. And we've also scroll down to our indicators, which we also took a little bit of talking through to have our 2 main ones of eviction filings and then people who are physically evicted, but then noting that that just looks at the number of people who are evicted, which doesn't look at displacement in DC, which is a large part of the housing issues. So we also have these other 3 indicators which help supplement that aspect. And then lastly, looking more at the programs and services that our stakeholders are doing and how that's increasing, decreasing over time, and fitting the needs of community members. And then lastly, in this document, we're looking at future work and where we can go towards, and especially looking at specific populations of people that this framework that's broader doesn't exactly target. And another aspect is we're looking at data sharing and data privacy among different stakeholders, which is also going to be a subcommittee of the stakeholder group, which is a difficult thing with government and court documents and legal things. So working through all of that as well. Leah, did you have anything to add?
No, I was just going to say the data sharing should be interesting. I haven't seen a lot of other jurisdictions where they're sharing between the court, like the Human Services Department, as well as legal aid and housing counselors. That would be the group who would all need different roles and access and those kind of rights. And the additional fun fact is that DC does have eviction expungement law in place now. So there would be an additional complication of records needing to be carefully access controlled and records scrubbed over time to remove those filings as time goes on. So we're really excited that this group is still continuing. We had not seen the eviction cliff that we might have expected, but recently I think eviction rates have started to go up. So we do think there's still continued need for this group to be meeting monthly. I think people are hitting up against the dollar amounts that our local emergency rental assistance is able to provide. People still really have high past due balances. So that's continuing to be a problem. And so they do expect evictions, physical evictions, to actually start increasing soon. Sorry to end on a downer. Should have ended with data sharing.
Ended with the libraries. We should have rearranged things.
I have a quick question. I'm curious, I thought it was really interesting that you said that you're going to continue to monitor certain demographic variables, acknowledging that those are the populations that are most susceptible to displacement and whatnot. And I'm curious how you will be tracking that, like what data sources you'll use and like indicators.
Yeah, we haven't actually gotten that detailed, but probably it would be your standard data sources at the moment. We don't have anything fancier in mind, but we can also work with like the Department of Human Services and others to the extent that they're able to track their client populations and to, assuming funding isn't cut, if their client populations are changing in different ways, we could think about that as well. Yeah, that was a big there were some people who really pushed hard against having eviction filings as one of our outcomes because they're like, well, easy, we can reduce filings, we just get rid of all the poor people. So we wanted to make sure that's not what we were measuring and not declaring success when we haven't had success. DC does have a historically very high number of filings, about 30,000 a year. So this is a lot of cases that get filed in the district. It's obviously down quite a bit now, but we're concerned about it going up in the future.
Leah, I'm sorry if I missed in the beginning. Who's funding the collaboration?
It is co-convened by 2 local funders, but the money to pay for us to participate is actually coming from JPMorgan Chase.
And we're working on a larger document with more details that also incorporates some interviews we've done with other groups in the community that aren't part of our core stakeholder group, and looking more in depth at processes and what to strengthen in the future.
Yeah, and we've got to mention we have a core group that we meet with weekly, and then we have a monthly larger group with a broader set of stakeholders. So we've tried to bring in different folks, like we had somebody from the Massachusetts Department of Housing talk. That Philadelphia has a really interesting mandatory mediation program pre-filing. So we brought somebody in from there to talk. And in September, we're actually going to bring in local lawyers for landlords to get the landlord lawyer perspective on what they're seeing and what they're in court and how they may try to help the situation. Because sometimes it's the lawyers are like, nope, they're the ones that are able to go back to the landlords and get the rent ledger that's missing. And they're actually helping the situation rather than being obstructive or just pushing filings through. And DC has done a lot of changes recently to legislation to put in greater protections. There's more notice requirements prior to filing. Unfortunately, those are not recorded, but tenants receive notice that includes information for legal aid and that kind of thing in those notices. And they recently, I think, amended when you get served, there was some not very good people just lying actually when they were serving tenants. So they've improved some of that.
Yeah, I'm eager to try to collect in one spot anyway, lots of folks are working on evictions in different pieces in different ways with different actors, with different collaborations or at different stages. It would be, yeah, we are a little busy at the moment, but maybe we could at least get some links together.
Yeah, I know the folks in Durham have been working on it. As part of that NLIHC Erase initiative.
And Atlanta was working with their Federal Reserve Bank.
Oh yeah, that's great.
But I know others have been too. Great. Well, thank you to Leah and Elizabeth for contributing on that. Tommy Pierce was going to present on rebranding, which I also am super fascinated by, but we will get him to present another idea showcase or maybe even at the meeting. So we'll make sure that the content gets shared about his lessons on rebranding on the business side. So thanks everybody. Thanks to the speakers. This was all super interesting. And nice to see two projects sort of at the end of their publication, and then as soon Leah and Elizabeth can be inspired.
We can get our document done.
As they're in the kind of middle of it, that's there. So I was happy to see the different stages. So I hope everybody has a great afternoon.
Thanks, everyone.
Thank you.
Thank you.